Hi, it's Dr. Johnson from Premier Smile Center, and today I want to talk a little bit about gum disease or bacterial gingivitis and its effect on heart disease. So for many years, over 20-30 years now, research studies have shown the correlation between gum disease and heart disease. And the question is, how does this work? Well, essentially what happens is the bacteria in the mouth travel throughout the body. There's blood vessels that travel from the mouth to the brain, head and neck area, all the way through to other organs of the body. And what we found is that the type of bacteria that's usually only found or is specific to periodontal disease or gum disease is found in other areas of the body when they dissect those organs. So what happens is the bacteria travel through the body. It causes inflammation of certain areas. So in the heart arteries, in the heart valves, it causes inflammation, and with a lot of patients who already have some sort of heart disease, there is thickening of the blood vessels that connect throughout the body, and the thickening of the blood vessels is called atherosclerosis or fatty plaque. So when the bacteria sit on that, it obviously causes inflammation, and that inflammation and irritation then causes more inflammation to develop within the blood valves and the heart muscle itself. And then it forms a thicker accumulation, and then that's how the arteries narrow over time. So that has been happening for, the research on that has been happening for years. They've dissected the arteries of hearts or arteries of blood vessels, and they've actually found bacteria that is very specific to gum disease actually in the fatty plaques of those heart arteries. So this is important because obviously heart disease is still one of the major causes of death in the US. And on top of that, with gum disease or periodontal disease, studies have shown that patients over the age of 30 have, there's about 50 to 70%. With patients over 65, 70% of those patients have some form of periodontal disease, whether it's gingivitis or actually a moderate form of the gum disease itself. So in essence, what we want to do as dentists is to make sure that you stay on top of your gum health, that you are brushing and maintaining and doing what you should be in terms of flossing, water picking, and using an electric toothbrush, making sure that you come for your regular checkup and cleaning so that we as a dentist can check and see if there's bleeding when we probe or check the gums. Areas where there's plaque accumulation, that we can guide you and show you areas that you're missing. Have you used something called disclosing tablets, which you can purchase from Amazon for like nothing, and that attaches to the plaque, so that after you've brushed, you use the disclosing tablets, it'll highlight those areas where there is still plaque, and so you can see where you're missing, because a lot of the time you have to actually see it to be able to know where you need to go. I found that often we'll tell patients over and over again, you got to brush here, you got to brush here, but they brush there and there's still stuff there, and so with the disclosing tablets you can actually see it for yourself. So those are the key things to come out of this is the better you are in controlling and keeping your gum disease under control, the better you are in causing less of an impact on heart disease. So I hope that helps, and if you have any questions, please feel free to call us and ask us. We've seen so many cases of this where there's the correlation that we want to be able to help you if you need. Our number is 954-566-7479.